Well, good morning, everybody. It's great to have you join us today. Welcome to our program called Extreme Heat Impacts on Human Health. My name is Lissa Radke, and I'm the Community Development Educator at the UW-Madison's Division of Extension in the Ashland County office. This program is co-hosted by Extension-Ashland County, the Wisconsin Department of Human Services, and Ashland County Department of Health and Human Services. Before we start, I've got a bit of housekeeping first. We are recording this presentation, and I'll post it in about a week on the Ashland County Extension website. You'll get a link to that website in a follow-up email that I'll send after today's program. You're welcome to type your questions or comments in the chat box throughout both presentations today, and we'll go through them at the end of the programs. I'm going to be putting several links in the chat throughout the program, so you can find more information about this topic as we go. Before our speakers begin, though, I have two short anonymous polls that will take about a minute each for you to complete. They're about 4 questions. The first poll is for your demographic information. Your responses to this poll help us ensure that our programs are reaching diverse audiences as required by our federal funders and our partners. So let's just take about a minute for the first poll. Here's question 2 of that poll. And we'll take about another 10 seconds. Thanks very much for taking that poll.
Listen, I don't know if all of us are seeing the second poll.
I'm going to launch that one right now. This one is another short anonymous poll to get your feedback on your own experiences with heat extreme events and any health impacts you might have had. And this one will help our guests understand sort of where you're coming from with your experience with extreme health. So here's that second poll.
Record.
All right, and I'll end that poll in 10 seconds. And here's where our guests are in their responses to the poll. So it looks like most people have experienced high heat events in their communities. And some of you have experienced harmful health impacts, some to a larger degree than others. And it looks like about most of you understand what some of the things you can do to protect yourself from high temperatures and humidity, which is great. And most folks think that weather conditions in our communities are likely to change in the future. So thanks for taking that poll. That helps us understand a little bit about where we're coming from today. So why are we bringing you this program this morning? Well, first of all, today is National Heat Awareness Day, which is observed annually on the last Friday of May in the United States. National Heat Awareness Day is an effort by the Occupational Safety and Health Administration and the National Weather Service. The purpose is to alert workers, employers, and the public at large about preventable health dangers related to heat in order to reduce the overall rate of illness and deaths caused by heat. This day was founded as a reminder that many outdoor workers, farmers, laborers, and all of us are at risk of serious heat-induced conditions. For example, already in Wisconsin this spring, we've had a record heat wave for 3 days in La Crosse on May 19th through the 13th. It was 96 degrees on May 12th, making it the 5th highest temperature during the month of May in Wisconsin. Now, La Crosse is about 200 miles south of here, but we've already had very hot days in our own backyards in recent years. So to talk with us about changing climate conditions and how they're creating more hot and humid days and nights, we have 2 speakers to help us stay cool. Maggie Thelen works with the Wisconsin Department of Human Services to give us a big picture of the heat conditions in the state. And Liz Szot from the Ashland County Health and Human Services Department will fill us in about local conditions. Our first speaker is Maggie Thelen. She's the Climate and Health Program Coordinator with the Wisconsin Department of Health Services in Madison. Maggie's going to talk about what's causing an increase in the number of these life-threatening days in Wisconsin, how extreme heat events affect our health, who is especially vulnerable to extreme heat, and it may surprise you to find who's suffering the most, and finally, what we can do to protect ourselves and others. So welcome, Maggie Thelen.
Hello, everybody. I am going to share my screen and then we can get going. All right, confirming again that everyone is able to see my screen.
Yes, we can see it. It looks great.
Awesome. Okay, so thank you for that wonderful introduction. My name is Maggie Thelen. I am the Climate and Health Program Manager with the Department of Health Services. And so today just wanted to give a brief overview of how climate change and extreme heat are related, as well as going over heat-related illnesses and human health impacts in Wisconsin, and then give a little bit of what we can do and what my program does about extreme heat. So most of the graphics that we're going to be seeing here in the next couple slides are from the Wisconsin Institute on Climate Change Impacts. They recently published their 2020 report with all updated data. And it confirms from a previous 2012 report that Wisconsin is becoming warmer and wetter. Here is just the historical change in annual precipitation. You see most of the state, at least southern Wisconsin, had significant percent change to annual precipitation. But what we're here today to talk about a little bit is that historical change in annual temperature. You can see there, Wisconsin has been warming increasing by about 3 degrees since the 1950s, and all of these were significant when the wiki scientists were able to calculate it. One of the big things that we're worried about with this 3-degree increase in temperature are those nighttime warming, meaning that we all know that it gets very hot during the day, but then your body is not able to cool down if it stays that hot at night. And so you can see here, especially in all of the seasons, where areas of northern Wisconsin the nighttime temperatures have been increasing almost 5 degrees. That is pretty significant when you look across all of the different seasons and all of the areas in Wisconsin. But then compare that to the daytime, where that temperature is not is only mostly significantly increasing during the winter and the spring. So all in all, it kind of shows that the nights are warming at a faster rate than the daytime temperatures, which is the most concerning for our program and for the health of Wisconsin. But the main question is then, how does this impact our health? who is most at risk and what can we do about it? So to dive into those questions a little bit, how does extreme heat impact our health? So often I think about extreme heat having both direct and indirect uh, indirect impacts. So there's the direct impacts of heat-related fatalities, heat-related illnesses, as well as sometimes the heat can have direct impact on water quality, causing algal blooms to bloom, and then people getting sick from that. The heat-related illnesses are the ones that we often need to watch out for mostly. The heat rash, the heat stress, the cramps, the exhaustion, and especially, which I did not list here, heat stroke. All of these have different types of symptoms within that a body can experience. And often people don't realize that they're experiencing the symptoms of the heat-related illnesses, and they let that go on too long without finding shade, getting access to water, or finding a cool place to regulate your body temperature down. I just have some data for the entire state of Wisconsin here. This is the number of extreme heat-related deaths in Wisconsin. Though these numbers do seem lower than one would think, because extreme heat is very deadly, these are just the numbers that medical examiners they put in the correct coding for death certificates in Wisconsin. So really, these are very underrepresented because heat can be a contributing cause in a lot of fatalities. And you can see here in 2012 was our last pretty significant heat wave across the state. There was also a drought along that year too, and many of the there was a higher number of heat deaths that year. Looking at the extreme heat emergency department visits, you can see the numbers are much higher, with 2012 during that heat wave also peaking with the highest amount of related emergency department visits. And the numbers are pretty steady, and and again, these are probably very much underrepresented, lower amounts of data, just because of how the hospitals code people coming into the emergency department. So I talked a little bit about those direct impacts of extreme heat, and now here is some of the indirect impacts. We're seeing a lot of significant mental health impacts related to extreme heat. You have those long heat wave days. You're not able to cool down. You're not able to regulate your body temperature. That can really impact your mental health. And there are certain types of medications that do not react well to extreme heat, where your body is not able to use that drug to help combat certain medical conditions that you may have. You also look at power outages. You have extreme heat. It can cause some strain on various infrastructure around your areas, and not having access to air conditioning and not having access to electricity to cool yourself down is a big threat. We have some evidence, I believe, of people who, when there's power outages and they're not able to, they pass away because of those risk factors that they have, and that they're not able to cool down. Also, there is the economic impact. People, if it's too hot, people aren't going outside. They're not going out to dinner. There's not a way to the economic impacts of the extreme heat. Maybe there's a drought and farmers aren't able to harvest their crops to full potential. There's all of the impacts from climate change are so intertwined, and extreme heat is right up there with a lot of these. Now, but then thinking, well, who is most at risk of these health-related impacts from extreme heat? We have a lot of data showing that the people on the screen right here, the conditions on the screen right here, are more vulnerable to health impacts from extreme heat. So adults over 65, they're not as mobile, not able to get around, not able to leave possibly to find air conditioning, to find a cooling center. Similarly, people living without air conditioning or living alone are sometimes aren't able to find those safe areas where they can go to. Looking at children under 5, kids often children don't know that they're overheating, that they're not able to regulate their temperature, that they need to find cooler air, or they need to drink water. People also with chronic medical conditions, I mentioned about the mental health impacts, and that some people with chronic issues take medication that could be impacted by extreme heat. Pets often are impacted a little more than humans sometimes, because they're not able to find cooling, and it's hard to communicate that to the owners that they need assistance. Outdoor workers, unhoused populations, people that are just outside a lot can be impacted the most with extreme heat. Also, non-English speakers as well are traditionally included in this, because they might not have the messaging, they might not get the alerts, they might not understand the heat-related alerts that are out there. However, do you remember this lovely graph that we had, emergency department visits? Well, what was interesting about this is that the risk factors listed here often aren't related to the emergency department visits. And so one of our partners that the Climate and Health Program works with is the Environmental Public Health Tracking Program. They worked with Minnesota's Environmental Public Health Tracking Program to do a Midwest heat analysis to better understand those heat-related illness risk groups. And so they looked at those emergency department visits across the 2 states, analyzing different levels at the county level risk factors, including occupation and age, as well as looking at sex. And I'm going to talk a little bit about key findings and how they were different than you would think with those traditional at-risk populations. We found that actually younger people between ages of 15 and 34 were more likely to visit the ED for heat-related illness, possibly thinking if they've been outside, they could be outdoor workers, thinking that they're going to be fine. The heat doesn't bother them. They're okay with it. But they presented to the emergency department much more than the other ages that are more traditionally at risk. We also found out that men were twice as likely to visit the emergency department for heat-related illnesses, meaning that they think that they can tough it out, or that, again, the heat doesn't bother them. They're fine. But we found that those are the 2 key areas that we need to figure out how to get the heat-related illness message and the heat-related safety messages out to the young people, and that the men and to males. We also found that counties with the higher heat index had more cases of heat-related illness, meaning that a heat index with higher temperatures, technically more heat-related illnesses. You would see La Crosse, as Lisa mentioned, La Crosse had those 96-degree days compared to probably Ashland's maybe like 75-degree days, meaning what we found is those higher heat index ratings would have higher amounts of heat-related illness associated with it, which makes sense. And we're happy that the data was able to back that up. And finally, we actually found that heat-related illness rates were significantly higher in rural areas than metropolitan areas. So the data was looked at, and we hear a lot in learning about climate change and extreme heat about the urban heat island effect. That's where there's the more urban areas with less tree canopy and more sidewalks and blacktops and everything have a higher temperature. They have the urban heat island effect. They don't have the cooling greens. Well, this study showed that between Minnesota and Wisconsin, that the rural areas actually were more impacted, had more were significantly impacted by extreme heat, resulting in higher areas of heat-related illness. So all of our traditional heat risk factors among our population don't really mesh well. So we really need to kind of think about how we can get the messages out to those that are most at risk. How do we communicate these the dangers of extreme heat? So that kind of thinking like, well, what can we do about it? What are we able to do? This is kind of where the climate and health program comes in. So the Wisconsin Climate and Health Program, we've been funded since about 2012, and we recently received another 5 years this year. And there are 11 different states and cities around the country to work on this that are funded from the Centers for Disease Control and Prevention to work on climate change related adaptation strategies. And our program studies climate change impacts on public health and uses best practices from across the country to identify adaptation strategies, tools, and trainings to help communities prepare for health outcomes from climate change in an equitable way. And one thing that we've learned with extreme heat planning is that collaboration and education is vital to extreme heat planning and response. Being able to know when the extreme heat is happening so that we can get messages out to the public. We know when to possibly set up cooling centers where people can go to get that don't have air conditioning that can go to cool down. We want to be able to work with our emergency management, work with the health department, work with human services to find those people that are most at risk and communicate with them on how to cool down and how to get air conditioning, how to find a public space where they are able to regulate their temperature, get water, and be able to then head back out if they need to. We work with our occupational health program to be able to help figure out how best to communicate these heat risks to the outdoor workers, to the seasonal, to the people that are out, to the seasonal workers, as well as a lot of people up in Ashland County. There's a lot of tourism along the shore. There's seasonal tourism workers that would need some of this communication too. It's the collaboration among different type agencies is super key to preparing people in Wisconsin for extreme heat. And just to let you guys know about our different projects that we have coming up or that we've been working on and that where we're going to share with everybody here. So we do have the Climate and Health Program has an extreme heat toolkit that was developed a few years ago, and we're going to be updating it with more additional risk communication and using what we've learned through various analyses with Minnesota, with our environmental public health tracking program, and with looking more kind of fully into emergency department visits to figure out how best to communicate this information so that people are able to take action when those heat days are coming. We also have a heat vulnerability index that we're hoping that we're going to be able to update. The heat vulnerability index, I believe Liz is going to show a little bit about that in the next presentation. It is a map that shows, that takes a bunch of different characteristics and shows where in the county more vulnerable populations to extreme heat could reside. And that helps out with governmental and non-governmental agencies to plan for how to best reach their population. Where could they prioritize resources for extreme heat related programs and planning? And finally, while this is the opposite end of the state from you, we are working with National Weather Service, UW researchers, the cities of Milwaukee and Madison's sustainability and sewage districts to look at developing a heat health warning system, whereas it's instead of just looking like traditionally at the humidity and air temperature, this actually looks at data of health impacts and incorporates them into a scientific algorithm that is beyond my knowledge, but it works. And it will be better at predicting those heat waves where people are not, where people could have serious health impacts. And so to be able to better prepare and trigger different risk communications out to the public. So I have a whole list of tools here. So the Climate and Health Program not only works on extreme heat, we also do a lot of work around flooding and other extreme weather. So I just wanted to share our webpage as well as a link to the toolkits. We have about 7 different toolkits ranging from harmful algal blooms to extreme flooding to chemical release, actually. And then tools, we have a couple different flood related tools, including the flood resilience scorecard, which is a comprehensive community assessment, being able to look at how your community's resilient to flooding and where improvements could be made, as well as a flood risk assessment tool. This is that we call the RAFT, risk assessment flood tool, that is a interactive GIS map that allows you to have the FEMA flood hazard layers overlaid with live river gauge data, as well as critical infrastructure, which is helpful in planning. So if you think about looking at both the heat vulnerability index and then possibly looking at the critical infrastructure, that your brain starts moving for how we can adapt our cities to have more resilient to these extreme weather impacts. As well as I put a link to the Minnesota Climate and Health Program, because I understand you guys are a little bit closer to them if there is more data that way. As well as all of their great work that they've done on analyzing emergency department data in Wisconsin and Minnesota too. All right, and that is the end of my presentation. Just we'll stop sharing.
Thanks, Maggie. That was fantastic. It's really exciting to see how the Department of Health Services is working with other states and agencies to do this kind of research and outreach, especially to those new target audiences that you talked about. It's really good information. And I will get all of Maggie's links from her after the end of this program and put them in my follow-up email for everybody. So we'll get those out to you. I've also added some of the links in the chat, but we'll make sure that all the ones that Maggie just gave us are included in that email. So a reminder, we'll take all your questions at the end of both presentations, but feel free to put them in the chat box as you think of them. So our next speaker is Liz Szot, and Liz is a registered nurse, a health officer, and public health administrator at Ashland County's Health and Human Services Department. She's going to describe Ashland County's heat indexes and what they mean to residents, as well as what the department does to protect our communities. So welcome, Liz.
Good morning, everyone. And just to verify, is my screen showing up the way we would like it to?
Yes, that looks great, Liz.
Okay, perfect. Realized this morning as we were getting going that I haven't actually done a full PowerPoint like this before, so I had my technical difficulties going on. So my name is Liz Szot, and I am, as stated, a registered nurse, the health officer and public health administrator for Ashland County Public Health. So just reviewing this morning some of the local extreme heat impacts that we have experienced in Ashland County, and some of the effects on human health and some things that we can do to alleviate some of the effects. And I need to move my little people on my screen here 1 second. There we go. Okay, so the first slide that we have here, this data is from the Environmental Public Health Data Tracker of the Wisconsin Environmental Public Health Tracking Program. So as you can see by this graph, there has been a noted increase in the daily maximum temperature over time with increased frequency of extreme heat days. The global climate change trends over the past 60 years show locations becoming generally warmer and wetter, and Wisconsin as a whole is no stranger to this trend, and neither is Ashland County. Changes in the climate contribute to drought, temperature extremes of both hot and cold, more precipitation and flooding, and more carriers of disease such as mosquitoes and ticks. Some of the examples of extreme weather events that we've experienced specifically in Ashland County. This slide shows a section of Highway 13 that had washed out after heavy rains. This was the bridge just south of High Bridge. So this was from the flooding event that happened on July 12th in 2016. During this event, the city of Ashland was actually cut off to road traffic after the roads and highway were washed out. The White River rose to 8.54 feet and the Bad River rose to 27.28 feet. These increases in water level actually broke all previous records for the flooding. And then this was an example of an extreme heat wave from July 19th of 2019. Temperature highs for the majority of the state reached into the 90s with high dew points in the 70s. So the combination of these two high numbers created heat indexes which were well into the triple digits. The tracking of trends and projections of heat and precipitation can help to inform decision-making and policies that can help local communities assess vulnerabilities, estimate the burden, and build overall resilience against the effects of our changing climate. As you can see by the information displayed on this side, the number of extreme heat days is anticipated to continue to increase in frequency. Ashland County is anticipated to remain below the overall Wisconsin average. However, we will continue to feel the effects of our warming climate. As temperatures continue to rise, there is an increased risk of more heat-related illness and death in both urban and rural areas. More intense heat-related events will threaten the lives as well as disrupt health and social services. Certain populations, such as adults who live alone or have limited social contacts, older adults, males who work or play outside, and people without access are continuing to be at increased risk for heat-related illness. The projected number of future extreme heat days is expected to increase in all Wisconsin counties over the next several decades. The Climate and Health Program at DHS studies how climate change impacts public health in Wisconsin. As part of this, an analysis of 60 years of weather data by the Wisconsin Initiative on Climate Change Impacts, or WICI, indicates again that Wisconsin has become warmer. Extreme heat can disproportionately affect vulnerable populations. Again, this is your population, specifically 65 and plus, people that are socially isolated or living alone, those with pre-existing chronic medical conditions, specifically cardiovascular disease, can pose an increased risk. The wiki used existing population and census data, natural and built environmental data, and health factor data to create the Heat Vulnerability Index, or the HVI, to identify areas of the greatest risk for negative health impacts due to extreme heat. The HVI incorporates 4 main data points, and each data point layer represented in this image. We have our population density, which is the number of or population per square mile. Health factors are included, which includes the prevalence of diabetes, adults with asthma, the rate of hypertension, percentage of obese population, individuals that are uninsured or receiving public assistance, specifically assistance related to substance abuse or receiving public mental health services, and populations that have previously visited an emergency department for heat stress. Demographic and socioeconomic factors are also included, and this refers specifically to the percentages of individual households living in poverty, children ages 0 to 4, adults age 85 or greater, adults living alone, adults age 65 plus that are specifically living alone, non-white population, and those with less than a high school education. And then the fourth specific area included is the natural and built environment. So this includes a lot of data specifically from 2012, which was, as previously noted in Maggie's slide, a very extreme weather year for high temperatures. So this includes the data specifically the hottest day of 2012, the average concentration, the maximum recorded ozone level, percentage of households without a vehicle, medium and high density land cover classification, and nursing home bed counts. So when all of this data is put together, the HVI for Ashland County is represented by the map on the left, and they also created tribal specific HVIs. So the Bad River Band of the Lake Superior Chippewa Indians is represented by the map on the right. The data displayed in each map is meant to serve as an informational tool for us to better understand the distribution of populations most vulnerable to extreme heat related events. So for a general overview on ways to protect yourself and tips for staying cool in extreme heat, a lot of information packed into this slide, which in this particular presentation is very squished and hard to read. So we will advance on to the next and kind of break it down a little bit more. So one of the main things that people can do to help protect themselves and their family from extreme heat is to stay hydrated by drinking lots of water. To avoid dehydration, a conscious effort should be made to drink more fluids during hot weather. Specifically though, do not drink liquids that contain a significant amount of caffeine, alcohol, or large amounts of sugar. These types of drinks can actually cause you to lose more bodily fluids. Checking on your neighbors, so protecting others. Make sure and make frequent checks on neighbors, friends, or relatives, especially if they are elderly, if they have chronic medical conditions, or if they are living alone. If necessary, you can assist them with moving into an air-conditioned environment during the hottest part of the day. Watch for any signs of heat-related illness, such as complaints of dizziness, headaches, muscle cramps, weakness, nausea, or vomiting. Call for immediate assistance or call 911 if they are experiencing any symptoms on a hot day. So more of the extreme symptoms of heat illness, such as hot, dry skin, if they are confused, if they happen to be unconscious, are complaining of chest pain or any shortness of breath that would be out of the ordinary for them. You know, you're definitely going to want to call for assistance and call 911 if necessary in those situations. Along with protecting others, you want to make sure and never leave anyone in a parked car, specifically pets or children. As well as pets and children, also individuals with disabilities, older adults, and not even for brief periods of time. Temperatures can rise to life-threatening levels in a matter of minutes. On an 80-degree day, the temperature inside a car can reach upwards of 100 degrees or greater in less than 10 minutes. And also for the furry family members, you want to ensure and leave them with plenty of water. And if they are outside, ensure that they have a shady area to rest, rather than just one of those like plastic igloo dog houses. Those can essentially become miniature saunas very quickly. So you want to make sure and provide them with a shaded area rather than just direct sunlight exposure. So shade and lots of water for our furry family members as well. If going outside, you want to make sure and avoid the hottest part of the day. If you have to be outside, try to stick to the cooler morning and evening hours. Wearing light, loose-fitting clothing and taking frequent breaks in air conditioning if possible. Although anyone at any time can suffer from heat-related illness, some people are at greater risk than others. So this is kind of another recap of the at-risk individuals. People aged 15 to 34 are most likely to visit the ER for heat-related illness, but older adults, if they are affected with heat-related illness, are more likely to actually be hospitalized. Infant and children up to 4 years of age are sensitive to the effects of high temperatures, and this is especially dangerous for them because they rely on others to regulate their environment and to help provide them with adequate amount of fluids. People age 65 and older may not compensate for heat stress efficiently. Some individuals are less likely to sense and respond to the changes in temperature. Some older individuals may have a decreased sensation for thirst. As previously mentioned, men are about twice as likely to visit the emergency room for heat-related illness as women. People who are overweight may be prone to heat sickness because of their tendency to retain more body heat. People who overexert during work or exercise may become susceptible to heat illness. And then individuals who are physically ill, especially with heart disease or high blood pressure, or people who take certain medications, such as medications for depression, insomnia, or poor circulation, may be more easily affected by extreme heat. When possible, try to stay in air conditioning on hot days. If you don't have air conditioning, you could always visit the library, take a quick trip to the grocery store in our area. Other than the grocery store, you could also visit Walmart, senior centers or community centers, or any other public space that has air conditioning available. Things to do in your home: keep your window blinds or your curtains drawn to reduce the heat, ambient heat in the home. Utilize ceiling fans or box fans, room fans to help circulate air and promote heat loss that way. If it is too hot in your home, you can always take a cool bath or a shower. A cool bath or a shower will actually reduce your body temperature faster than air conditioning will. So, without air conditioning in the home, it's, take a quick run through the shower in the afternoon hours. And then, monitoring and being alert of what is going on for, extreme heat. Watch local weather forecasts to plan for outdoor activities safely. Be aware of commonly issued warnings or advisories, such as a lookout statement or the outlook statements, heat advisories, excessive heat watch, or an excessive heat warning. So each of these kind of gives the different degree for the potential for extreme heat events and how hot it could be. And it applies to both daytime and nighttime hours. So if it's, for an example, a heat advisory would be if the daytime heat index values are expected to be between 105 or 114 for 3 or more hours, or if it's going to be greater than 80 degrees at nighttime, you would be experiencing, under a heat advisory at that case. And then I also included then as well some of the resources or reference sites. I believe some of these might be duplicate resources as well. But as previously noted in the chat, that this information then will be included in an email that will be sent out. And that is the end of my slideshow. So I'm going to close that.
Thanks so much, Liz. That was really informative. There were a lot of things in your presentation about what to do to protect yourself and prevent any kind of heat-related illness or effect that I had no idea about. So I really learned a lot and I appreciated it. And thanks for mentioning that there are public places to go for that have air conditioning. I did call our county and area libraries, and all of the librarians said that the public is more than welcome to come to a library on a hot day and enjoy the coolness and all of the books and services that they offer. So thanks for mentioning that. I wanted to say you're welcome to put questions in the chat. And as Liz mentioned, she's going to email me her links and I will put those in the follow-up email as well. There's so many good resources out there for further exploration about what you can do and how you can help others who might be affected by hot days. I wanted to address one of Liz or Jan Penn's questions in the chat, and then I've got a couple that were emailed to me before the program for people who couldn't make it. So we'll have about 10 more minutes for questions. So feel free to keep putting those in the chat, or if you prefer, just unmute yourself and feel free to ask those. So Jan is wondering how the departments of health, both in Wisconsin and in the county, are working with other agencies to address recommendations in the governor's climate task force report.
Yeah, I could definitely answer some like from the state perspective. So the Climate and Health Program was, well, we were not members of the Governor's Climate Change Task Force. We were attending all the meetings and providing subject matter expertise as needed as the report and the recommendations were finalized. We also have a pretty good relationship with the Office of Sustainability and Clean Energy. And so as those recommendations have been put into the Wisconsin Clean Energy Plan as well, we have been involved with that as well. Initially, we took all of the recommendations that the task force put out in their report and identified where the climate and health program could be of assistance, how we could work with the other agencies involved for how we can expand on the work and the recommendations that were in that report. So we have been working on a lot of that, and we actually were specifically mentioned in the Clean Energy Plan. So I'm really looking forward to seeing where we are going to be addressing the recommendations there.
Nice. And Michelle asks, this is for you, Maggie, what is the Extreme Heat Toolkit? What does that include?
Yeah, so the Extreme Heat Toolkit is a pretty good document that was made by the Climate and Health Program a few years ago, and it includes, I want to make sure that we have includes background information on extreme heat and the trends in Wisconsin. It includes different types of practical response strategies for how people can take action, and includes a lot of template press releases, talking points. It provides useful reference materials, and we have them all on our website. Actually, the Extreme Heat one has been translated also into Spanish, and you can grab and go and share the toolkit components as needed.
Forgot to unmute myself. Thank you, Maggie. That sounds really helpful. I got a question on an email from someone who can't join us today, but he is a worker on a utility crew and said it can be especially hard for our crews to stay cool on the job because of the nature of our work. Is there anything special that we can do to stay safe? I know Liz had some great strategies for what you can do that I suppose would work for road crews. On a utility crew, you know, they might be up in trees or in buckets or cranes or something to help them get to power lines. So I'm not sure if there's anything special that they can do to stay
And
safe while they're out in the field.
yeah, and I mean, depending on the utility work that you're going to be doing, you know, obviously this would be much more difficult depending on the work that you're doing. But I know some utility crews do have the ability to kind of work at off hours. So either the very early morning hours or later in the afternoon to try to avoid the hottest part of the day, the hours with the most direct sunlight, that sort of thing. But otherwise, you know, it's going to be the frequent breaks, the lots of fluids. You know, everybody always, you know, you don't want to tell the highway crew to take frequent breaks, but you know, everybody always has that comical ish or image. But you know, there are reasons for that because it does get very hot being out on those road crews and things like that. So frequent breaks and hydration, and if possible, taking a break in the shade are most definitely necessary.
Great, thanks for that, Liz. And someone had mentioned in the chat that there could be cooling jackets. I hadn't heard of those. I know there's some jackets with built-in heaters for really cold days, but I hadn't heard about cooling jackets. But it does remind me of those gel handkerchiefs that I guess you kind of crack them and beads open up inside the handkerchief that you wrap around your neck, and it feels really cool. I don't know if you've had experience with those being effective or not, but that might be one option. I have another question I got this morning. I know I feel better if I sit in front of a fan when I'm hot, but how effective really are electric fans in preventing heat-related illnesses, or am I just feeling better but not really being safe?
So there is a level at which fans are no longer effective. I'm not entirely sure on the temperature or the humidity that is. Liz, you might know better, but fans are effective up to a certain point because once it gets too hot, it's just blowing hot air at you, and there is no cooling factor involved.
Yeah, and I don't know if there's a specific kind of threshold for the temperature. You know, I think that might partly be dependent on the individual as well. But it is, you know, as Maggie stated, it's to a certain point they are effective, but then after that you might be, you know, looking for air conditioning or, you know, go jump in a cool bath or something to that effect will help to cool you off a little bit more, and then step back in front of your fan after the cool bath or shower.
Mm-hmm. And Liz, this might be for you. A question that came to me privately in the chat was, when do we see a doctor if we suspect we're overheated? There's sort of trigger points or, you know, certain temperatures or things that we say we need to get to see a doctor or go to the ER?
Yeah, so that would be, you know, if you're experiencing any of the symptoms that I had mentioned, let me try to get the full list of them. You know, specifically any dizziness, if you are having, you know, hot, dry skin, anything that would really indicate, you know, that a person is overheating. I know I have the full list of symptoms right in front of me someplace here.
I know it's hard sometimes when I feel like I've
Right.
overexerted myself and I'm hot and uncomfortable. Maybe I'm starting to feel nauseous, and I'm not sure if is it time to go to a doctor or should I just go lay down with iced tea?
Yep, and I mean that's the thing too. You know, if you're starting to, you know, starting to feel the effects of heat, you know, you're going to obviously want to get out of the heat, try and cool yourself down, start, you know, having more fluids, things like that. But specifically, like the warning signs would be the dizziness if you start to have a headache, muscle cramps, any feelings of weakness that would be out of the ordinary for you. You know, as you mentioned, like the nausea or vomiting, immediate things that you would definitely want to call for assistance for, like I said, would be the hot or the very hot and dry skin. If you're experiencing any confusion or you're with someone who's experiencing any confusion, you know, obviously if somebody's unconscious, definitely you're going to want to be calling 911 for them. Complaints of chest pain or shortness of breath, those are the definite things that you know want to make sure to get to the emergency room for. The lesser symptoms of the dizziness, headache, cramps, things like that, that's where you want to definitely take steps on your own of, you know, fluids, air conditioning, cool shower, things like that.
Great, thanks Liz for detailing that for us. And I want to mention that Michelle put something in the chat that's useful too, some symptoms that she's typed for us of what to look for and when to be really on the alert. And I do want to mention that anybody can save the chat if you want the links that we've put in today in the comments. Go down at the bottom of the chat box and you'll see a section that says to everyone, and all the way to the right are 3 little dots in a row. You can just click those 3 dots and it'll say save chat. So you'll be able to get information from the chat, but also we will put all of that information into our follow-up email. We've got just about 3 minutes left, but I wanted to take George's question. Do we provide postable extreme heat advice extreme heat advice info to hiking trail managers to post at trailheads, which is a good way to give hikers a heads up that it's a really hot day and you should take extra precautions. Have you ever heard of that?
Not heard of that, but I really like that idea of being able to work on like pretty direct messaging, I think all summer long on extreme heat at those trailheads. And maybe we can connect with DNR or the park system to try to figure out ways that we can communicate those risks.
Great idea. And thanks, Maggie. You've got a link to a graphic that the CDC has on symptoms and what to do. So that's really helpful. Any other comments or questions? Let's see, I think I had one more from an email, but I think you've answered that about exercising. People like to exercise daily, such as running and biking, but you had mentioned that really on very hot days, you should try to find times in the morning or the late evening or afternoon when the temperature is cooler if you want to get your daily exercise in. So I think we answered that one. I have put a link to a short anonymous evaluation in the chat that we invite you to take and tell us what you learned this morning and also what you'd like to learn. If there's more that you want to hear about climate change, impacts on human health, or other aspects of climate change, you can use that survey form to tell us what you'd like to see in the future. And I just wanted to say this has been an enlightening program to get ready for the hot summer ahead. Here's Wisconsin weather in a nutshell for you. It was 32 degrees at my house near Brule last night, and the forecasted temperature for Monday is 80. So we know our temperatures can vary wildly, and it's important to know what to do to stay safe when conditions are bad. One last check for questions or comments. Well, I want to thank our speakers, Maggie Thelen and Liz Szot. I think we've all learned a lot to help us prevent health impacts the next time it gets really hot. And I want to thank all of you for joining us. Be safe out there on your holiday weekend and take good precautions. Thanks for joining us.